These diseases which slay our people were brought by the white man. They brought the epidemics, the influenza, scabs, the measles. Michael King, in commenting about access to health care at a later time, in this book by Te Puia, wrote, in regard to Waikato Māori, in 1906, he wrote, "There were few doctors who would attend Māori patients, and no hospitals to admit them to, and no preventative health measures." It's just over 100 years ago. The nearest hospitals were in Auckland and Hamilton, but they really took Māori patients and didn't want to. He went on to say, in his Penguin History of New Zealand, that for a long time the official attitude to problems of Māori health and welfare was to ignore them. The Auckland Health Officer, in whose district the bulk of the Māori population lived, stated in 1911 that Māori health should be of concern to Europeans, but only because the unchecked spread of Māori diseases could eventually lead to Europeans contracting them. As matters stand, he wrote, "The native race is a menace to the well-being of the European." Now just contrast this with the lament from Tangi Kangahau, only 14 years older, about his 7-year-old granddaughter. Fortunately, there have been massive improvements in Māori health since then. However, there's still room for improvement. I would just like to pause now and just acknowledge the tremendous work done by Manaia PHO and many organisations and people in Northland, and I think that you're leading the way in so many ways, and I admire and salute the fantastic work you're doing. So the things I'm saying aren't applying to the direction and the fantastic work we're doing, but we do need to reflect on the whole of New Zealand and our history. So we can appreciate that in recent history there have been hardened racist attitudes against Māori by some doctors. And I have to say there is prejudice in our European whakapapa. Back to Tūhoi. Unfortunately, institutional racism outside of the health service also occurs and is present today. And this impacts directly on child well-being, which is why I'm speaking about it, of course. At Mangapohatu, on the 2nd of April 1916, police entered the peaceful community to illegally arrest Rua Kanana and others, and 2 Tūhoi men were killed. Despite the police claiming in court that while they were present in Mangapohatu, women and children were unrestricted, it is clear from this photograph, here with the policemen armed policemen standing by the women and children, that under armed police guard that was not the case. 91 years later, on the 15th of October 2007, only 4 years ago, Tūhoi children were again frightened by extreme police behaviour, this time at Ruatoki, on the other side of the Uraweras, but still in Tūhoi territory. Police dressed like the man in this photo confronted children in a variety of situations. On the side of the shed in Ruatoki, it says, "I cried because we were hungry and scared, 5 years old, 15th of October 2007. This is likely to be reporting the words of one of the children, as reported to Howard Broad, Police Commissioner at the time. And this report said, one man said he counted 43 police officers surrounding the house where he lived with his partner, his 4 young children, and his father and his partner, and all of these police dressed in military attire, like I showed you before, had guns trained on the house. A loud hailer was used in the early hours of the morning, ordering the occupants of the house to come out. They did so, to the shocking scene of being confronted by these bandido-like persons pointing guns at them and their home. The occupants were immediately detained. Sometimes they were directed towards a designated area where guns were continuously trained on them, and were told not to move from that spot. In the other cases, they were placed in a shed or moved to a police van. These prisoners, mainly women and children, were kept under armed guard and detained for varying periods of between 3 and 6 hours. The children particularly were terrified. Their clothing, blankets and food were inadequate, and they were not permitted to re-enter their homes to obtain more. On both of these occasions, police failed to protect Māori children from the effects of their police-induced trauma. Since these episodes, in the episode in 2007, police have taken no steps to ameliorate the effects of this trauma on the children. Treaty of Waitangi? Surely we can work together better than this and protect our most vulnerable citizens. I'm now going to turn to some health statistics and a bit more boring down into how we're doing in child health in New Zealand, and want to show you how we're doing compared to other countries in regard to the conditions in which I work most commonly, being a medical paediatrician, serious bacterial infections and respiratory diseases. And if we just look here, these are the diseases here. These are a rate of 1 given to other countries in the OECD, and this is the New Zealand relative rate. And you'll see at the peak of the meningococcal disease epidemic, our rates were 5 to 17 times other countries. Rheumatic fevers, nearly 14 times other countries. Serious skin infections, 2. Whooping cough, 5 to 10. Pneumonia, 5 to 10. And bronchiectasis, 8 to 10. Massively bigger than other comparable countries. Horrifically bigger. But as Paparangi Reid said, we kind of got used to it, and it kind of sounds normal, but it really ain't. What about inequalities within New Zealand? So this is looking at similar diseases, a few more here, and common or important infections and other diseases. And here's the least deprived neighbourhoods in New Zealand, and the rates are given as 1. And then we look at the rates of these are hospitalisations for these conditions, and look at them in the NZDEP 10, the 10% of the most deprived areas, and see the rates here, not just a doubling, but rates, 5 times, rheumatic fever, as you know only too well in this area, nearly 29 times, bronchiectasis, these frightfully damaging, lifelong damaging diseases, 16 times. So really high rates, huge inequalities. And if we look by ethnicity, we see that a very stark differences there too, with the same diseases listed here. And for the European rates here, Māori rates double, 4 times, rheumatic fever very high, and Pacific even more horrendous rates for some of these diseases, really horrific. Asian Indian, which are becoming a big part of our childhood population, the only thing that they stand out really high is around TB, which probably reflects the countries of their origin and TB rates in those countries, but otherwise they are doing pretty comparably to European. Oh, gosh, a few years ago, Helen Clark was talking about closing the gaps, and we've all been beavering away. But, unfortunately, some of these health inequalities are increasing despite the passage of time. And I want to draw your attention to the fact that rheumatic fever inequalities are increasing. So here we have all the people in New Zealand who aren't Māori and Pacific, and you see the rates from 1996 to 2005 are actually slowly going down, whereas Māori rates are going up and Pacific rates are going up, and of course they're stupendously higher than the non-Māori, non-Pacific rates. So we've got increasing health inequalities. This is pretty new information, but some of you may have seen it. It came out in September last year from Liz Craig, data analysis from the Children's Social Health Monitor, looking at conditions, hospital admissions for conditions that had a social gradient, and seeing what was happening with them over the last 10 years, 2000 to 2010. And we've got them by ethnicity here, Asian, actually slow but catching up and actually going up slightly. Remarkably constant level for European, New Zealand European children. But for Māori, 50% higher to start off with, and look, the gap is widening. And then Pacific kids way up again, even higher. And you know, the gap is huge. So we have increasing inequalities on the background of very high inequalities. So that's a pretty concerning picture. So these problems have complex origins, which we call the determinants of health. This isn't just about one thing that's causing us or one thing that can fix it. So let's just reflect on that for a moment. What are the determinants of health? And Professor Sir Geoffrey Rose from London, who's one of the gurus in public health and preventive medicine, in 1992, in his lovely little book, The Strategy of Preventive Medicine, said the primary determinants of disease are mainly economic and social, and therefore its remedies must also be economic and social. Medicine and politics cannot and should not be kept apart. By politics, what we really mean is policies. It's the policies that are the key, not a particular politician. It's what goes into policy that is the key. Another thing that's very important to note is maternal educational achievement is the single most important determinant of child health. And so immediately we see here that we've got social, economic and education as key in all of this. Closer to home, we had a National Health Committee led by Professor Robert Beaglehole of our university. In 1998 they brought out this document, Social, Cultural and Economic Determinants of Health in New Zealand, Action to Improve Health. And they said, social, cultural and economic factors are the most important determinants of health. There are deficiencies in income, education and housing which contribute to ill health and the marked ethnic disparities. There are immediate health gains to be made by applying information and knowledge that is already available. And to my assessment of their recommendations, probably the single thing that's changed in this 14-year period has been that we've actually starting to get the immunisation rate right. But there's little else has changed, unfortunately, despite this call to action by authoritative figures. Now, I'm wanting just to give you a little bit more of my take on some of these issues. I became particularly engaged about this area, this issue of why we've got such big health issues in children when I saw this graph. Now, this here is looking at serious skin infections, and you'll notice here serious skin infections were ticking along at the same level, and suddenly between 1994 and 1998 there was a doubling of serious skin infections. Now, all of those of you who are doctors and nurses will know to get a doubling of a disease in a 5-year period, whoa, what the heck is happening? And if doubling in 5 years, that's almost unheard of for something like this. Maybe an epidemic or something, but something that's not of an epidemic type of disease. So I thought when I saw this, there must have been a tipping point at that time that's tipped our children to getting more hospital admissions for serious skin infections than they've ever had before, and way exceeding any other comparable country. What's going on? And it wasn't long before I pieced together my own story, which I'm going to put to you, about the triple jeopardy for health of many children in New Zealand. And I joined this Child Poverty Action Group to kind of learn a bit more about the broader aspects of health. And what we do know is right now in New Zealand, there are, depending on how you measure it, there's 22 or 26% in poverty by an income dollar definition. But if you look at it another way, there's 19% in severe or significant hardship. So whatever way you look at it, there's at least about 1 in 5 children in New Zealand are lacking some of the necessities, and we're talking about having to put off going to the doctor because they can't afford it, not having food on the table when they